Hello, everyone. This is Dr. Jennifer Genty, functional medicine doctor. I am doing a FAQ, a frequently asked question in regards to ozone therapy. At the time I am recording this, we have a special promotion running right now in our clinic in Denville, New Jersey, Wellness Corner NJ, where you get ozone with three passes, okay? Three passes. The concentration is 100 ml syringe. If you know ozone, you know what I'm talking about, but know that you get a lot more than most clinic will offer. And at the end, we will give you a minimized cocktail. So this promotion has been running for 2 weeks, and the last time to purchase it will be this Friday, November 15th at 3 p.m. I am a firm believer that you need to know what are the tools and the resources that are out there to help you understand what you need to do to heal your body. Ozone happens to be one of the therapies that has promising results, really, that has been proven to work significantly well for all my patients, whether you have whatever conditions you have, right? But if you suffer with tiredness, chronic fatigue ozone will be great for you. Now, since this is the last week of running our special promotion, I've collected a few questions that patients have. And as you see on the screen, if you're watching this on YouTube, or you might be listening to this on the podcast, head over to YouTube. You see the questions. I have some answers, but I'm gonna just give you my own, answers as well. So let's get it right into it because I don't want to keep this video too long. Now, the first one is what exactly is ozone therapy and what are its benefits? So I thought people know what ozone therapy is, but obviously not. But ozone therapy is a medical grade gas that we use. It is odorless. It has no like it's clear gas that we use where we combine three oxygen atom and then we infuse that oxygen to your body. I do the infusion. You can do ozone as you can inject it into your joint. You can do in enter it. Is that the word? Insulation into your bladder, into your rectum, but I do it into the vein. So we inject oxygen gas into your blood and then we return it back into your body. What it does, not only put oxygen into the cells. As you guys know, I tell you that your cells are those little tiny workers that work for us every single day. We need to take care of them, and many of them are dying due to increased inflammation, poor immune system, or toxicity. So because they are dying, they're not able to perform to give us to create energy for us, to give us that vitality, that energy that we are looking for. Okay, so ozone therapy stimulates the immune system. That is why it is perfect for autoimmune. It is perfect for Lyme's disease. It is perfect for bacterial infections, viral infections, mold infections. Like it is really good for any pathogenic activities, and then reduces inflammation, support detoxification process. It is one of my favorite therapy for chronic infections and also for chronic fatigue. All right. So the second question I have here is some therapy FDA approved and why not? Okay, that question is very popular because as we hear about ozone, what do? We go ahead and Google it. And then when we do Google it, we find out that it's not approved by the FDA, right? Again, as I mentioned before, if we are being honest with ourselves, the FDA only approves either a medication, a pill, or a surgery. And it it's not pretty out there for the people that are taking the medications or for the people that are having surgeries. I have a patient right now that is currently receiving ozone therapy for back pain, and that patient already had three back surgeries, and she has a stimulation already inserted, and yet she's still in pain, right? To the fact that she can't even move around and she has to take multiple breaks. So now they want to go back in to do more back surgery. She's like, no. Well, quote, hell no. So now we are doing ozone, and she is on her second infusion, and she's doing well. Okay, she has pain, but the pain is less frequent. So when it comes to FDA approved, why is it not approved by the FDA? It's because it is not one of the things that there's no patent, right? You cannot take that little therapy and put it into your pill. All right. And then according to the FDA, there are no clinical research, which is not true. There are many clinical research. Ozone has been in existence since the 1900s in countries that are healthier than us, like Asia and Europe. Like medicine over there is way better than us, than medicine in America. So if we're waiting for FDA to approve certain things, that will never happen. We'll continue to be sick and we'll never be healthy because what is being approved by the FDA is not really creating the health and wellness that we so desire. I'm going to leave it as that. If ozone therapy is not approved by the FDA, is it safe? It is very safe. I have been doing ozone for the past 4 years now. I have yet to find a problem with ozone. As a matter of fact, it's the opposite. It is so safe that it's people see results within days. Yeah, days. Again, I do things differently here in our clinic. I'm using different tools besides the oxygen that I'm infusing into people's body. I'm also using a higher dosage. I'm also using different tools like the LED and UV light machine that I use that most practitioners don't. Maybe that's why people see results faster and quicker in my practice. But I just have yet to do ozone therapy on people and they'll be like, oh, Dr. J, I didn't feel the difference. Now, the difference might not last because that's why we ask that patients do more than one. Because, since it is not a covered service, since you do have to invest in yourself, people tend to do one and that's it. No, you got to do more than one. I usually recommend 6. That's why we have the special bundle promotion so I can encourage people and motivate them to purchase 6 so they can really see long lasting results. All right, next question. What is the difference between oxygen therapy and conventional medications? I'm telling you, those questions are juicy. All right, so as you can see, this is questions that other people will answer. Ozone therapy is me stimulating your own healing mechanism to heal your body. There is no toxicity with ozone therapy. I'm not infusing toxins into your bloodstream, into your body. I'm literally giving your cells the oxygen, giving your tissues the oxygen, giving your organs the oxygen so that your cells can be wide awake and go to work. Okay? So because of that, there's less inflammation, there's more immune system boosting, and there's less pain. And with medications, we think about side effects, we think about numbing the symptoms. We think about synthetic chemicals. Okay, I don't know. There are two things we need with ozone, like two things that are necessary for ozone to work. Your blood. Oh my God, what is happening here? I'm also streaming on Facebook and there's like balloon going. Sorry. Your blood and oxygen, that's it. You can spend days without eating, hours without drinking water. You cannot spend a milliseconds without oxygen. We need oxygen to survive. So that's why ozone is so great when you go to a clinic who knows what they're doing, right? But the practitioners know what they're doing. You can feel a difference within days. And that difference is really energy first. If you have brain fog, so you have decreased brain fog, and then whatever else. If you have autoimmune, please get ozone. Like autoimmune conditions, whatever it is, lupus, RA, multiple sclerosis. I'm gonna do a whole webinar on autoimmune to tell you how ozone can help with autoimmune. Lyme. We live in New Jersey. Whew, Lyme is big in New Jersey. And those bacteria, they're not going away, right? And I saw a patient the other day who got Lyme 4 times. Every time she had Lyme, they kept giving her doxycycline. So the fact that the doxycycline is not working anymore, and now she is dealing with residual side effect of the Lyme not being treated properly. Ozone therapy is gonna go into your body, get the oxygen to work, and then whatever the tick inserted into your body, ozone therapy is going to help address that by decrease the inflammation, stimulating your immune system, which is the soldier in your body to go fight for you. Can medications do that? No. How much does ozone therapy typically cost? It depends on where you go. It depends what type of ozone you get it. As I mentioned before, you can do joint ozone, you can do bladder ozone, you can do rectal ozone, you can even do skin ozone. But if you get in the major autohemotherapy, which is what we do here, which is the infusion, get ready to spend at least $500. Now we have a special promotion running into November 15, 2024, where you can get 250, one infusion, one session for 250 with the mini Myers cocktail, which is not the price. Okay, it's more than that. But before we did the promotion, before we released the promotion, our ozone was 300. Even with that, that was very cost effective. So I'm telling you, if you're looking for ways to invest in yourself, and you want to have a stronger body, give ozone a try. I am telling you, whatever it is that you face with, ozone will help. What conditions can ozone therapy help treat? That's the next question. Ozone therapy is used for a range of condition. It's used for a wide range of condition. I'm so excited, I can't even speak. Chronic fatigue is first on my list. If you feel fatigue, you're fighting the cold, you're fighting the flu, you're fighting allergies, you have respiratory issues, ozone will be perfect for you. If you have chronic infections or you keep getting sick, ozone therapy will be perfect for you. If you have autoimmune conditions, cancer, Lyme's, ozone will be perfect for you. Again, what does all these things have in common? Fatigue, right? Like if you were to have a cold right now, flu, what's going to happen? You're going to feel tired. You want to lay down. And I don't know about you. This is the end of the year. I got things done. I got to get things done. I have a to-do list. I have a long task of things to do. So I need my energy. I need my brain to function. I need to be productive. So we got to go. But chronic fatigue is at the top. Okay, I've treated patients with respiratory infections. I've treated patients with cardiac. Like ozone is good for 134 diseases and conditions. Epstein-Barr virus that 95% of the population has that we don't know of, ozone therapy is good for. Um, Herpes, ozone therapy is good for. HIV is a virus, ozone therapy is good for. But fibromyalgia, ozone therapy. How many sessions of ozone therapy are usually required? Again, it depends on what we are treating, depends on individual, depends on the toxicity level, depends on the severity of the symptoms. But I usually tell patients to start with 6. Now, the recommendation is 10 or more. I say start with 6 and then we evaluate and then you'll see how well you do and then you can continue. But it depends. Like it's not like 6 for all the conditions. That's why you have to work with a practitioner who knows your specific situation, condition, and can recommend the required amount of session that will be beneficial for you. How quickly can I expect to see results from ozone therapy? For my patients, days. You do ozone today, I'm telling you, give it 24 hours, 78 hours, you should feel a difference. Now, again, response to ozone therapy, some people notice benefits just after one session, while others requires several treatments. But I've been doing ozone for 4 years now. I'm telling you days. You gotta go to a practitioner that knows what they're doing, a clinic that does a lot of ozone. But ozone you shouldn't take a long time to feel the effect. Now, is it gonna be slight improvement depending on how many treatments you get? Yes. But you should literally feel a difference because again, it's oxygen to your body within days. Who is a good candidate for ozone therapy? Everybody. Everybody. We all have issues. We all have cellular issues. We all have some aches and pains we can address. We can benefit from extra oxygen into our brain, into our tissues. Like some of us have brain fog. It's ozone. We're gonna infuse oxygen to your brain tissues. Lyme's disease, inflammatory disease, weak immune system. Everybody that is looking to improve wellness. Can ozone therapy be used for preventative health? Yes. I use ozone as a preventative health, okay? Because I don't want to wait until I'm sick to do something about it. I want to do something about it now. Because the worst thing is for you to wait until the house is on fire and then now you try and identify why your house is caught on fire, right? The worst thing for you to do is to wait for the foundation to be weak. By that time, you're going to require a lot more ozone and it's going to be more challenging and difficult for you to heal your body. So for me, preventative care is the best care in the world. Prevent, okay? But increase energy, detoxification. I mean, I'm always looking at ways to increase energy no matter what. So yes, so I fall into the preventative health. What forms of ozone therapy are available? As I mentioned before, we can do IV, injection, IVs, injections you can do for skin, You can put ozone in water. It's yeah, you can do multiple things with ozone. What should I expect during an ozone therapy session? Again, I can only speak for my clinic. When you come in, we take great care of you. We draw 60 ml of blood. We put it into a fluid that is of normal saline, mix the blood. We inject oxygen, and then we run the blood to UV light, LED machine. We do 3 passes. Like usually the session takes 30 to 60 minutes. Since we are adding a little mini Myers cocktail, so that may be a little longer, but there's no pain at all. The only pain is like us inserting the needle to get the blood. Like you would feel the pain even if you were to go to a conventional laboratory to draw blood, it's the same thing. After that, you feel nothing. No pain at all. Like people are amazed how simple, fast, and effective this treatment is. Are there any dietary or lifestyle recommendations during ozone therapy? Well, it should be the same. Eat healthy, drink water. The more water you drink, the more hydrated you are, the easier it is for us to find the vein, the more it easiest for us to get a lot of blood. So we tell our patients to drink water, but there's no specific dietary or lifestyle recommendations specific for ozone. It should be the same thing you do every day. Nutrient-dense diet, um, drink plenty of water, stay away from the processed and toxic food. If you take any special medications, let us know. But again, it is safe. There should be no interaction. It's oxygen, right? So this should be fine. How does ozone therapy compare with other alternative treatments? Well, ozone therapy is different in a way that we are giving we are infusing oxygen into your body. Vitamin C, chelation therapy, hydrogen peroxide therapy, these are different. These are products we are formulate into a bag and infuse that into your body. For ozone, we're not putting any product into the bag. The only thing we put into the bag is your blood and oxygen. There's no there's no vitamins except for the minimized cocktail, which I do, but it's not required. Most practitioners don't do that, but I like to give my patients extra stuff so they can feel better quicker and faster, so they can get a return on investment. I do that, but no. Vitamin C is good for inflammation and immune system, but again, like with everything else, you have to do multiple dosage and multiple infusions, and the dose always also is important. Herbal protocols are something you do at home, but ozone has a specific focus on cellular oxygenation, right? So ozone is quicker and faster and at reducing inflammation and boosting the immune system. That's why you feel a difference. Is there a risk of ozone toxicity? Absolutely not. No. Again, I'm gonna say no, but you have to go to a clinic that does ozone on the regular to make sure that it is safe. But for me and my patients, no, because safety is our number one concern. What if I don't feel better after ozone therapy? I have yet to find a patient who doesn't feel better after ozone therapy. If you don't feel better after ozone therapy, then there's a lot more issues at the cellular level we need to address. And that's why we do require you to do multiple infusions so that you can load your cells with the oxygen, right? If you have a higher toxicity level or like cancer, for an example, when you have metastasized, right? Cancer spreading throughout your body, 1, 2, 3, 4 might not work, right? Because it's like you have multiple cells that are targeted, that are diseased. So therefore you have to do a lot of ozone therapy. But again, for me and my patients, I can only speak for what we do here. People see an improvement no matter what conditions they have within days. Does insurance cover ozone therapy? Nope. This instance most insurance plans in the US does not cover. No, insurance because it's not FDA approved, right? Like remember, FDA, insurance, and big pharma are like related. So of course it's not. It's not covered by insurance. It's not. So it is an investment. You can use your health savings account or your flexible spending account, but you have to look at this as something you're doing for your body that's gonna give you the results that you're looking for. That's gonna decrease the toxicity level. That's not gonna numb your symptoms. That's actually gonna address many of these issues. What is the difference between medical grade ozone and the ozone in the atmosphere? Okay, that was a beautiful question that came in. And that question came from a chemist, a scientist, because again, when you Google ozone, you will read and see all these terrible things. And they are referring to the ozone in the atmosphere. It is toxic and dangerous to have ozone in the atmosphere. Medical grade ozone is different in the fact that it is a purified gas that we put into your body, right? If you go to the hospital, the oxygen we put into people's nose with the nasal cannula, that's what I'm actually retrieving. I'm retrieving, and put that into the bag. So instead of putting it to your nose, I'm putting it to your vein. So it's going all over your body. So therefore, it is different. And then we use a generator, right? We use different tools to make sure that it is safe and it's not gonna hurt you. So, but the answer that another practitioner answered is that medical grade ozone is highly purified form of ozone, free from pollutants, and produced under controlled conditions, which is true. That's what we do in our clinic. Atmospheric ozone, on the other hand, is a pollutant formed by sunlight reacting with pollutant in the air. While atmospheric ozone is harmful to breathe, we don't breathe ozone, okay? Medical grade ozone is used therapeutically in controlled dosage. So please, I don't do medical ozone. And then whenever you see something bad about ozone, that's what the government is referring to. They're referring to the atmospheric ozone. Can ozone therapy help with pain management? Yes, yes, yes. Because pain is inflammation. By reducing inflammation, reducing muscle spasm, muscle contraction, you relaxing the muscles, you feed in oxygen to the muscle cells, the muscle fibers, you're increasing circulation, you promoting tissue repair, you're gonna have less pain. Yeah. So if you have arthritis, rheumatoid arthritis, fibromyalgia, sports surgery, back pain, neck pain, joint pain, headaches. I had a patient who came to my clinic 2 weeks ago who had a migraine. We did an ozone. Within hours, her migraine went away. And she saw how many neurologists? How many medications was she on? Yes, ozone is very good for pain because something is creating the pain, the inflammation, the discomfort. Ozone help with that. Can ozone therapy help boost energy level and mental clarity? Yes, yes, yes. I'm telling you, when it comes to energy levels, ozone is perfect because that's the first thing we kind of lose as we are getting sick, as life is getting in the way, as we're super duper busy, we lose energy, right? We are exhausted, we are burnt out. So ozone therapy can help revive those cells by giving them some oxygenation. Mental clarity, of course, the brain fog will literally decrease and you have mental alertness because you're infusing oxygen to the brain tissues, to the brain cells, right? So yes, it is going to help all that because it's addressing the cells. So it's going to reduce oxidative stress. It's going to enhance overall vitality and stamina. It is really good for chronic fatigue and brain fog. Can ozone therapy be combined with other treatments? Absolutely. My patients are doing herbal therapy. Some of them are doing our detox protocol. So you can, again, it's oxygen, right? Like it's very safe, like whatever. And I have patients that are just new to me. They're not part of my protocols that are taking medications doing ozone. The only thing I tell them is that um, monitor the medications because there's a possibility that they might need less medications when they do ozone. So for all of you that are on blood pressure medications, monitor your blood pressure because ozone is good for cardiovascular disease. Okay. Just make sure you have a handle of what is happening with your body, with your supplements as you're doing ozone. So evaluate and assess. What's the difference between ozone therapy and oxygen therapy? Oxygen therapy is 2 oxygen atom, right? Ozone is 3, so you get more, right? So to address the hypoxia, which is low oxygen level in our bodies, that's how the body becomes so diseased, right? In the hospital, they give you the nasal cannula, the mask. For ozone, we add in 3. So 3 is more powerful than 2. So you're getting a lot more to really enhance cellular oxygenation, to reduce inflammation, boost immunity, and improve your overall health, vitality, stamina, mental clarity. Is ozone therapy supported by conventional doctors? That's a great question. Most doctors are getting on board because they're seeing that patients are not doing well, so they are questioning why the medications are not working or why the medications are creating more damage than good. And some doctors are just, they are like like very minded, like one side, my way or the highway. I want to hear about this thing that FDA did not approve. So some are conservative, some are not. But it is getting more awareness specifically for autoimmune, chronic fatigue, and Lyme's disease. So because patients are asking questions, like consumers are raising concerns, they're like, what about this therapy that doesn't involve me popping a pill? Can this work? So conventional doctors are open to it, but again, it's not all of them are there yet. Are there long-term effects or benefits of ozone therapy? Yes, 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 yes. The more you do, the longer the benefits will be. That's why we do more than one. Um, Again, as I mentioned, more oxygenation, decrease in inflammation, decrease in pain, help with autoimmune conditions, like boost immune system, like it's ongoing long-term side effects. You have to do a lot. How do I prepare for ozone therapy sessions? For us here, just hydration, eat. There's no special preparation. We do all the work here. You just have to make sure you drink plenty of water so we can get the vein. Um, since it is not a toxic therapy that's going to interfere with medications, there's no special therapy. So we don't do injections. So if you're doing joint injections or if you're doing bladder instillation or rectal, there might be some special preparation for us. We do all the preparation here since we do IV. Can ozone therapy help with viral infections? Oh my God, yes. Epstein-Barr virus, Coxsackie virus, cytomegalovirus, mold. Mold is not virus, but also help with mold, herpes, like shingles and the cold and the flu and COVID. Yes. Again, decreases the inflammation. It is antiviral, antibacterial, anti-inflammatory, boosting your immune system. So those viruses are decreasing the viral load. Those viruses, you give them a run for their money. Can ozone therapy help with skin conditions? Yes, 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 yes. Ozone can help with everything. Is ozone therapy environmentally friendly? Yes, because it is a medical therapy we use medical grade oxygenation. So it's very safe. We're not doing as atmospheric ozone. So yes, it is a controlled amount. It's very safe. Is it safe to drive after ozone therapy session? Yes, absolutely. Again, it's oxygen. If you might feel a little relaxed, but not to the point where you're sleepy, you don't need a driver. Like my patients will come in, get ozone therapy, and go back to work. Yeah, yeah. So you don't need someone. So this answer here is false. You can drive because again, we're giving you all the tools and the resources. It's good for your body. It's only gonna improve. So you don't need anything. You don't need anybody to drive you. Can ozone therapy be used for weight loss? Yes. That's a question I get, and people are not looking at it that way. People undermine ozone therapy. So the way ozone therapy is good for weight loss, it's because it's improving metabolic function, it's boosting energy, right? It's giving you that stamina. It's reducing inflammation in the that are inflammation that is in the fat cells. Some patients feel so energized to the point that they can go out for a walk. They have the energy to cook, to prep, to do meal prepping, to go to the gym. Like they feel so well. It's like, oh my God, I'm gonna move my body. That's how ozone therapy can be used for weight loss because you're not gonna find yourself sluggish and tired, want to sit on the couch all day long. You're gonna have that motivation. You're gonna be empowered to get up and move your body and actually go to the gym. And by doing that, you will lose the weight. Can ozone therapy benefit mental health conditions? Yes, because again, it helps with mood, it helps with focus, it helps with energy level, helps with mental sluggishness, helps with brain fog. It's oxygen to your brain. Yes. Is ozone therapy legal in the United States? Oh God, here we go. It's not FDA approved, but yet a lot of practitioners like myself are using it because it is so beneficial for our patients. So sorry, FDA, I'm gonna do what's best for my patients, okay? So that's why we call it off-label. There are so many things out there that are off-label. All this Ozempic or metformin, all these things that are being used for weight loss, injections or pill, they were placed in in the market, they were released for diabetic, right? Like take metformin, for instance. I have patients that will come to me that are not diabetic and they are metformin because metformin helps with weight loss. We call that off-label, right? Ivermectin, for example. Ivermectin is, for parasite, but people are prescribing it for COVID. COVID is a virus, right? So there are a lot of things that are off-label that are so beneficial. So practitioners like myself who knows about the research studies, with articles that partner up with scientists, right? In the functional medicine world, we use what is so safe, so effective to help our patients. Ozone therapy is great. How can I find a qualified ozone therapy practitioner? That's a great question because not every practitioner is qualified, right? So I would say you can Google. Google is going to be um our best friend. So if Google were to give you an IV vitamin therapy near you, so I would do IV vitamin therapy near me, right? And then go on the website, or you can even call them, say, hey, do you do ozone? Now ozone's becoming more popular. Why? Because again, people are getting sick, they want a second opinion, they are tired of not getting results, they are tired of doing everything asked of them and still not seeing the results. So I will call the IV vitamin therapy because they has to be done in IV vitamin therapy and ask them. Or you can go to the American Academy of Ozonotherapy. Ozonotherapy. They might have some there for practitioners that's closer to you. But if you put ozone IV vitamin therapy near me or ozone therapy near me, just make sure you ask questions. Make sure they do that every day so I can get the best. Um, ozone treatment because not all ozone treatments are created equal. We all do things differently. So it depends on the practitioner, depends on the drive to get people results. They might change. Some people do one pass and charge a lot of money, and then they, talk to the patients about doing multiple. Us, we do 3 passes so that people can really see the difference, see the benefits and the improvement right away. All right, so if you are interested in getting ozone and you live in the New Jersey, Connecticut, New York area, and you are willing to drive here to Denville, New Jersey, I would love, 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 love to have you. I can guarantee you'll see a difference within days when you do our zones because our focus is to give you all the things that you need that's going to make a difference so that you can see and feel better within days. We have a promotion that is running by the end of November 15th, 2024, where you can get ozone therapy infusion. We do 3 passes and then followed with a mini Myers cocktail, which is hydration fluid, normal saline, with B vitamins to kind of enhance the cells. We use different tools here. And our customer service is none like other. We'll check on you, we'll answer your questions, you'll be comfortable here. And most of all, you will see results, right? You'll feel better. If you have autoimmune diseases, Lyme disease, chronic fatigue, cold, flu, viruses, COVID, ozone is great for you. Pain, ozone is great for you. So if you're interested, or if you listening to this or you're watching this, you're like, oh, how can I get on this promotion? Because that promotion is gonna go away. This is the second time we're doing this promotion in 4 years. And after it's done, it's not coming back for another 4 years. So if you want to pay $300 for one ozone therapy or $250 for ozone and mini Myers, which I think is a great value, right? Specifically, if you're wondering what else you could be doing to help you feel better, then I would just get on the promotion, give us a call. You can see all our links below. You can, if you're watching this on social media, you can DM us, but I would love to get our hands on you so you can see the difference, so you can see what energy feels like. Because many people, they forget about how energy feels like because they've been, tiredness and fatigue happens to be the new normal. And I would love, love, love for you to change that mindset, for you to feel amazing, finishing the year strong and going into 2025 with a different level of health. All right. Again, I'm Dr. Jennifer Genty. I'm Dr. Jennifer Genty, the owner of Wellness Corner NJ here in Denville, New Jersey. Functional medicine, what I do best is to help my patients identify those causes of the symptoms, help them eliminate them by creating a customized, individualized protocol. I use IV vitamin therapy as a secret sauce. It's no longer a secret for people to feel better quicker and faster. any questions at all, you can leave comments, subscribe, and I'll see you in the next video. Until then, you have a great rest of your evening, afternoon, and see you soon.